So this is continuing neuroanatomy part 5. Okay, we are gone up to right up to the scalp, layers of the scalp. Now this is triangles of the neck. You can see the questions regarding triangles of the neck. This is the anterior triangle. Okay, the two triangles in the neck. This is sternocleidomastoid, which is dividing the neck into anterior and posterior triangle. Then anterior triangle is further divided into 4 triangles by two the muscle. This is the hyoid bone. This is superior belly of omohyoid. This is inferior belly of omohyoid. If you see this superior belly, anterior belly of digastric. Then this is stylohyoid, from the styloid to hyoid bone. So this is forming submandibular triangle, submental triangle, muscular triangle, carotid triangle. So if you see, submental triangle is just anteriormost, and anterior boundary is this muscles for the muscular triangle. Below the hyoid bone, HTC, hyoid, thyroid, and cricoid. These are the 3 bones. So these are the anterior triangle has got 4. Posterior triangle, inferior belly of omohyoid is dividing into superior posterior triangle, and this is also called as supraclavicular triangle. So if you want to go directly for the posterior triangle, now this is about the posterior triangle. Anteriorly you see anterior border of trapezius. This one is the posterior triangle. It is forming, this one is posterior triangle like this. So this is trapezius muscle. So anterior border of trapezius forming the posterior border. Then anterior border is formed by the posterior border of sternocleidomastoid, and this is the middle third of the clavicle. This is one, this is second, and the third. The contents, the most importantly, this is the posterior triangle. It has got important contents are external jugular vein. Now questions about this is there again and again. Posterior triangle, accessory nerve passes and accompany the vessels. If you see, there are so many vessels and nerves. The most of the questions are asked about spinal accessory nerve. This nerve, whenever it is damaged, because it is supplying to sternocleidomastoid as well as trapezius. So any lipoma or any surgery is there, you damage this spinal accessory nerve, the difficulty in shrugging the shoulder, and this causes this sternocleidomastoid, so torticollis. So brachial plexus pass with the subclavian vessels. If you see lower down, this is complete posterior triangle, and this is, you can see, omohyoid, inferior belly omohyoid. Here this is subclavian artery, the vein. If you see scalenus anterius is like this, vein is in front, artery is behind, lower part of brachial plexus are going. So you can see upper trunk and middle trunk. This is a brachial plexus. Okay. Then what you see, subclavian artery, third part, subclavian vein is there. This is external jugular vein. This is passing like this, external jugular vein. So it is totally crossing from posterior triangle to the anterior triangle. So it is superficial. A person, visible vein is seen. This is external jugular vein, just crossing over this. And you can see these are the smaller nerves, third and fourth cervical nerves. This forming great auricular nerve going up. This is again transverse cervical nerve, supraclavicular nerves. So these are the smaller nerves. The important nerve is spinal accessory nerve. Now if you see, what are the contents? External jugular vein, most superficial. Third part of subclavian vessels. This is the subclavian vessels. You can see third part, first starting behind this scalenus anticus muscle. This is the third part. From here it is going. This is clavicle. Then first strip it becomes the axillary vessels, axillary artery and axillary vein. So third part of subclavian vessel, axillary nerve. This is important. 11 nerve, brachial plexus part with subclavian vessel, cervical branch of cervical plexus. Lesser occipital C2, lesser occipital, greater auricular, transverse cervical, supraclavicular. So these are the small 4 nerves. You can see supraclavicular, it is coming. This is supraclavicular, C2, C3, transverse cervical towards the cervix. Cervical means cervical area anteriorly, and this is lower. And you see greater auricular going towards the ear, C2, 3. Again C2, lesser occipital supplying towards the occipital area of skin, greater auricular towards the behind the parotid gland. So this nerve, greater auricular, is most commonly damaged in parotid surgery. So So this occipital part of the scalp is supplied by lesser occipital nerve. Spinal accessory is important, crossing horizontally. Third and fourth cervical is directly downward. Dorsal scapula, this is toward the scapula. So this was about the posterior triangle. If you see the anterior triangle, I already told there are 4 different triangles. It is divided into 4 triangles. You can see now. Submental is the anteriormost. If you see the muscle, the flat muscle, mylohyoid muscle, it contains submental lymph nodes, anterior jugular vein. These are the contents. Submandibular means submandibular gland, important structure is submandibular gland. Then again mylohyoid muscle is there. Linguine and hypoglossal nerves. These are the 2 important nerves which cross from here. So one is hypoglossal nerve, it is absolutely crossing like this. This one lingual is going above, and this one. So 2 nerves. So this is the hyoid bone, this is thyroid bone, this is cricoid bone. So this is infrahyoid muscles, strap muscles, thyroid. So this is one nerve coming to the infrahyoid muscles. Then you can see lingual and hypoglossal nerve, facial artery and vein. Again, if you see here, submandibular gland is there. This is the artery coursing like this, and facial vein will be like this. So there are 2 important vessels, facial artery and vein. We will see when we will read on the submandibular gland. Muscular triangle is the anterior. You see there anteriorly there is thyroid cartilage, thyroid bone, and thyroid cartilage, and along with thyroid and parathyroid gland and strap muscles, infrahyoid strap muscles. Then you see the carotid triangle. This is important triangle. This triangle is carotid triangle. You see important structure is the carotid artery, common carotid artery. This one common carotid artery encloses. Then the carotid sheath is there. So internal jugular vein has to be there. Common carotid or internal carotid has to be there. And along with these 3 nerves important, 9th, 10th, 11th. Accessory nerve we have seen it is coming from there. Spinal root is supplying to this, and again in front you say accessory nerves. So 9th, 10th, 11th nerves are also there in the carotid triangle. This is accessory nerve here crossing like this, it is in there like this. So anteriorly ansa cervicalis, again this strap muscle supplying to those. So ansa cervicalis rounds like this from below. So strap muscles has to be cut upper level, as there should be no injury to ansa cervicalis. So all the muscles of infrahyoid are supplied by this. You get TOS, thyroid, omohyoid, suprahyoid, and this. So except T, which is supplied by C1 along with the hypoglossal, all the muscles are supplied by ansa cervicalis. 2 other important triangles are submental and submandibular, just below the submandibular and submandibular area. So suprahyoid muscles, as we have seen, anterior and posterior villi of digastric. Digastric muscles have got suprahyoid. So mylohyoid muscle, floor of the mouth. This is transverse floor of the mouth. We separate it from the neck. Stylohyoid, from stylo. You can see these are the muscles like this. This is the hyoid bone. Just if you want to see it clearly, this one is the hyoid bone, and above these are suprahyoid, and below these are infrahyoid. So how to see this? You can see genohyoid in the center. This one blue colored. Mylohyoid is a fan-shaped muscle, brown color. It is like this completely. The green color digastric, anterior belly and posterior belly. From this anterior belly is dividing this into submandibular, and this is submental triangle. So submental triangle is like this. In the center, genohyoid, anterior belly of digastric is the boundary. So suprahyoid muscles. So this was about anterior and posterior belly of digastric. Green color, 2 bellies of digastric, and stylohyoid from the styloid foramen, styloid process to the hyoid bone. This is stylohyoid. So this is dividing the triangle like this. If suppose you see the anterior triangle, this is sternocleidomastoid, and this is the center. This is the anterior triangle divided into anterior belly of digastric, and this is stylohyoid muscle. So this is submental, submandibular, and this is forming the carotid triangle. and this is muscular triangle here, muscular triangle. So genohide, the nerve supply mylohide and anterior belly of digastric from mandibular branch. This mylohide and anterior belly of digastric and mylohide. They are supplied by minor triangle and posterior belly from the facial, and genohide from C1. So digastric mylohide DMGS, digastric mylohide, anterior and posterior belly from anterior belly of digastric, posterior belly from the facial nerve, posterior belly from the facial nerve, and stylohide from the facial nerve, and genohide from the C1. Stylohide from the facial, genohide from the C1, mylohide from the mandibular nerve. Now this is submandibular gland. Most of the questions which I asked about this is the mixed parasympathetic. It has got secretions from the chorda tympani. It's while going to the lingual anterior 2/3 of the tongue, it goes to it forms chorda tympani. So mixed parasympathetic, chorda tympani or the facial nerve, Wharton's duct. This question is there. Wharton's duct from the submandibular gland. Parotid is different. This is Wharton's submandibular. This is below, and opening is frenulum of the tongue. You can see here, this is frenulum of the tongue. Tongue is lifted up, and you can see there is opening. So this is the basic gland which secretes maximum saliva. That's why whenever you get the taste sensation, whenever you get salivation, it is below the tongue. More is below the tongue. So nerves which are related with the submandibular gland as marginal mandibular, most superficial nerve, and incision on the gland is 2 cm below the mandible, angle of the mandible, and below mandible 2 cm. This is again the question. It to prevent the damage. Most common nerve to be injured during submandibular excision is marginal mandibular. If you see, this is submandibular gland and this is marginal mandibular nerve. So we have to remember this. Vein is passing from above and artery is going from below. You can see submandibular gland is in green color, vein is from above, artery is from deeper. So that's why, and the many nerves are passing very close. Marginal mandibular, lingual, hypoglossal, these are the nerves which are crossing. So interesting part is that this submandibular gland, it has got the duct. This duct is called as Wharton's duct. This Wharton duct is opening in the below the frenulum, and lingual nerve is just hooking it. It's just going like this, hooking. So whenever any surgery you are doing in this duct, any stone impacted in the duct and you are trying to remove it, this lingual nerve may be damaged, and damage to lingual nerve will cause loss of taste sensation, anterior 2/3 of the tongue. Taste sensation from the anterior 2/3 of the tongue is a triple relation to the duct. Laterally, first of all, it is laterally, then it is below, then it goes medially. So LPM here you can say lateral, inferior, medial. Hypoglossal after excision of submandibular gland, deviation of tongue, if there it is ipsilateral, same side diagnose damage. So facial artery and the vein. How is the relation? Facial vein is first vessel we made during surgery. So facial vein is superficial, is passing above, and artery tortuous anterior and border of the masseter. At the anterior border of masseter, this is the relation of the artery. This is the masseter. It goes is near the anterior border. This is masseter muscle. So this is about the submandibular gland. Questions which are coming for Ludwig's angina. Ludwig angina is describe infection in the submandibular space. Now this submandibular gland, below that if there is infection that gets land. Most common cause organism is O2. Whenever you do any dental surgery, infection or in the dental case, once developed can spread to retropharyngeal space. This is the question. Retropharyngeal space. Most life-threatening complication Ludwig angina is airway obstruction. Therefore, airway management is foundation. So any surgery or infection of the dental glands lead to transfer of infection from this space into the retropharyngeal space. So next, coming to parotid gland, if you know, it is in front of the ear. The parotid gland is situated. How is the secretion? It has got water secretion. The more secretion from the duct of parotid is called as Stenson's duct, and Vartans is for the submandibular. So watery and serous by parasympathetic, lesser petrosal LP. Greater petrosal is for the ciliary and the true pterygoparotid fossa to lacrimation, and lesser petrosal for parotid gland. Lesser petrosal of glossopharyngeal nerve. So glossopharyngeal nerve is coming here. Sternum superior to masseter. It pierces the buccinator muscle. This is buccinator, but and opens at the upper second molar tooth. So if you want to do surface anatomy, it is like this. In front of the tragus, then this is the ala of the nose, and this is the angle of the mouth. Midpoint of this, just join this line, and middle 1/3 of the horizontal line. So middle 1/3 horizontal line from inner tragus to middle point of the, here will be the parotid duct is passing like this and opening here, upper second. So nerve most commonly cut during the parotid gland is greater auricular. Greater auricular. This is greater auricular, not any of the facial nerve. Greater auricular is like this. It is going from here. As we have seen, greater auricular nerve. If you just go and see the posterior triangle, so again here you can see this is a greater auricular. Again, if you are going to see the greater auricular nerve, you see this one. This is greater auricular nerve. Greater C23. This is going towards the parotid gland. So it is very superficial. So injury to any surgery during parotid gland, you damage the greater auricular nerve. This is the question most commonly asked. The nerves may be injured at facial nerve. If it is injured, it is in the lower facial motor nerve palsy. Post-surgery patient develops. Another question is that post-surgery of the parotid gland, you get dust, sweating and meals due to regeneration of parasympathetic fibers of auriculotemporal nerve into sympathetic fibers innervating sweat gland. So this is the question specifically regarding Frey's gland, Frey's syndrome. What happens? The sweat glands have got sympathetic supply. So what happens means due to regeneration of parasympathetic fibers of auriculotemporal. Auriculotemporal nerve has got parasympathetic fibers. All the glands, all the ganglion, they are having parasympathetic. So whenever your surgery is done, there is regeneration of this into the sympathetic. So crisscross stimulation that leads to sweating in this much area. After doing this, Frey's syndrome. So Frey's syndrome, what happens? There is, if this regeneration of parasympathetic nerves of auriculotemporal into sympathetic nerves of sweat gland. So blood vessels, retromandibular and external carotid, you can see this greater auricular nerve. See, this is the greater auricular nerve. It is coming above the gland and supplying the superficial auricular in front of the ear. So whenever you are doing any surgery in parotid, these nerves are going to be damaged first. Greater auricular nerve. Then the facial nerve is from deeper, and the branches are deeper. So this is about the parotid gland. You see carotid triangle. This is important triangle. As I told, this is the anterior sternocleidomastoid. It is now dissected. You can see clear cut. This is common carotid divided into external carotid and internal. External carotid is medial. Internal carotid is lateral. Internal carotid has no branch into this neck area. Once it goes inside the skull, first branch is ophthalmic branch. And if you see external carotid, this division of